a nonpartisan, research-oriented organization with the intent to bridge research and policy so that we can advance prevention as a mentality and as a priority area in our society. There's so often that we tend to focus on reactive solutions like there's crime and we need to solve that, right? There's disease, we need to solve that. Well, what if we can prevent it from ever occurring? There are scientific-based approaches that can reduce the likelihood that these problems occur in the first place and save taxpayer dollars. So that's what the coalition is about. As part of the coalition, I am the coordinator for the Research to Policy Collaboration Project. And that project is designed to have me act as a liaison between policy and research communities. And this is sort of a different take on traditional advocacy, so to speak, because I'm not a lobbyist. I don't come to offices necessarily with an agenda. I want to figure out how I can support offices with the work that they're already doing. And so oftentimes I'll have questions like, what can I help you with? And I'm like, well, actually, what can I help you with? And so my meetings are a bit different in that way. And that's actually how this briefing came about. I talked with Amy Boston and Representative Sensenbrenner's office about the opioid bills, and she said, I think there's a lot of questions in this area, and I think it would be really great to bring a panel of experts together to share additional information with folks and have time for questions. And I said, okay, well, we'll see what we can do. And so here we go. Today we have a panel of experts here to join us and share what they know and take some questions. And so with that, I also am sometimes asked questions like, if you had a magic wand, what would you do to improve the world? What is the coalition's objective in that way? And that sort of took me back, but I think that at the big picture level, if we could do things that strengthen families and schools and support children earlier in their lives, we could reduce a lot of these problems. And that's sometimes missing from discussion. What I hope is that by bringing people together around current priorities, we can also sort of turn the needle and make a bit of a difference in affecting the dialogue in our communities about how we can have more proactive approaches that complement our existing approaches for tackling existing problems. And so with that, you may be thinking, where's the federal government's role in that? I'm happy to talk with any of you about that. I think that there's strategies that can be in place that support local communities and states' implementation and capacity for doing things that support families. And so at the end of the day, we have a lot of kids who are in vulnerable situations, and if we could prevent those vulnerable situations and those risks, they would be less likely to be part of this opioid epidemic or be part of this mass incarceration problem that we have. And there's a lot of underlying common factors there. And so I just want to put that out as a tidbit for you to sort of think about and bringing those conversations forward in your future work. And so I think that the other things I wanted to cover are just sort of housekeeping. Please make sure to sign in. We would love to have your information just for our own records so that we can know how well we are attended. Thank you all for joining us. This is an amazing turnout. And if you didn't get the handouts at the table at the front, there are handouts there for you. And each of our speakers here will talk for about 15 minutes and allow time for questions at the end, as well as some time for questions and answers for discussion at the very end of all of the presentations. Last but not least, I want to thank our co-sponsors, including American Orthopsychiatry Association and RTI International, as well as other organizations that have supported our speakers here today, including the National Association of Drug Court Professionals and the Urban Institute, as well as the National Institute of Drug Abuse. Today's focus is on the opioid epidemic, and I hope that you guys can find some ways to think about how science and data-driven approaches can improve the effectiveness with which we can address problems in our society. And at this time, I'm going to turn it over to John, who's going to be our moderator for today. Thank you so much.
Thank you for that. Appreciate it. So, I'm John Roman. I'm a senior fellow at the Urban Institute based here in DC. I've been studying drug policy and the economics of crime for almost 20 years. And I'm on the board of directors of the National Prevention Science Coalition. And I'm delighted to moderate the session today. Let me introduce the panelists. And let me just say, I think this is really an important discussion, and it's a really timely discussion. And I think we've got multiple perspectives on this discussion. We have a policy lens, we have a therapeutic lens, we have a rehabilitation lens, each of which are important to understand the problem. How did we get here? Where are we going? How do we fix it? So that's what we're going to try and do today. I would ask the panelists, I think we might have some tiny tech issues, so maybe that will just encourage us to go quickly and turn to questions, which I think, given this turnout, suggests that people are really interested in this, and I suspect there are tons of questions. And so let's sort of just describe our perspective, and then let's move forward as fast as we can. So we're going to start with Scott Novick from RTI. Used to be our Research Triangle Institute, but now I believe it is just RTI. And I'm going to introduce all three of you, and then I'll call you up. I'm sorry, sir. I had the privilege of working with their organization for 8 years on a Department of Justice funded study on drug courts that looked at therapeutic and rehabilitative responses to opioids and cocaine and marijuana and alcohol. And it was they are consummate professionals. He's going to talk about the course of the opioid epidemic, how we got here and how we can fix it. Then we're going to have Terrence Watson. We're not in the right order, but we're going to go over there and over here, and that's going to keep you interested, I think. He's the Chief Operating Officer of the National Association of Drug Court Professionals. I am pleased to have been associated with the National Association of Drug Court Professionals by being on the board of their journal for the past, I believe, 4 years. And it's a terrific shop with multiple dimensions. There's the National Drug Court Institute, which is more of their sort of philanthropic training, technical assistance sort of arm. So they do a bunch of different stuff. Monstrous community that they are engaged with. Thousands of members come to their conference. It's a very impressive place. So he's going to talk about drug courts and the response to this rise in the use of opiates, including medical assistance therapies and some other issues. And then I'm really pleased to introduce, in the middle, Kenzie Preston, who's a PhD in pharmacology, works at the National Institute on Drug Abuse, where she's been for the last 25 years, and in their intramural research program. And she's going to talk about treatments for opioid dependency, where we've been and where we're going.